Hey, Better, Richer, Stronger. We are back with ADA President-elect Brett Kessler. And if you saw us previously, you might notice that we have the same outfits on. And that's not a coincidence. We just didn't want to run a too long piece. And we have a few other things to talk about. And if you missed our first one, it's in the archives here at Better, Richer, Stronger. But Brett Kessler is bringing a incredible perspective to a position that is very, very powerful to do a whole lot of good. And I'm excited, Brett, for what you are going to bring to the table in your term as ADA president. So welcome back, my friend.
Thanks. Good to be here. Good to see you. Haven't
Yeah,
seen you in a while. How you been?
yeah. Brett, offline, we were talking about, we want to talk about the profession as it is today and where you see it going in the coming years and decades. But let's talk about some of the absurd. Let's talk about the good, the bad, and the ugly today. So let's start out on a positive note. What tell me some of the good stuff you're seeing nationally in dentistry today. Let's just start out with a little bit of good. Just keep everybody's
So
mood
I
okay.
I still feel dentistry is the most fulfilling profession in all of healthcare, because of what we talked about last time, the relationships that we can have with our patients and the impact we can have on them, not only their oral health but their overall health. And that's really why we went into dentistry in the first place. The positivity that we can bring to our patients' lives through our unique skills and our unique gifts that we can share with them. Dentistry is growing. We year after year after year, we have record number of applicants going into the dental field. Dental education is getting a little out of hand, cost wise, not a little, a lot out of hand cost wise. And we are working on finding ways to reduce, not, the ADA's, play with helping our young dentists out has been, just trying to make the dental loan repayments easier for them by offering lower interest rates and things like that. But
Mhm.
let's go to the root source. Why is it so expensive to train a dentist? And so we've got a task force put together that Dr. Edgar has put together to really look at lowering the cost of dental education. And so you'll see more about that in the next few months. I'm really excited
Excellent.
about that,
That's awesome.
because it is
That's awesome.
becoming prohibitive.
We were kind of furrowing our brows and scowling and also laughing at the same time about some of the absurdities that um, we have to deal with in dentistry. And I think your perspective on our professional responsibilities and also others' responsibilities to us and to those we serve to take proper care of them. We talked about an implant in the mouth versus an implant in the hip. And you said it so
Yeah.
well. I'm opening up the door. Just barge right through it, Brett.
So we've been selling ourselves short with what we do and the impact we make. Why is it okay for us to place a titanium rod in our hip? I'm pointing to my hip right now. Okay.
Yeah.
Why is it okay to get a titanium rod in our hip but not in our mouth?
Yeah.
I don't care what color I am, how old or young I am, what sex I am, how much money I make. I can get a titanium hip, but I can't get a titanium tooth.
Yeah.
Why is it that we have allowed the best possible medical advances to happen everywhere else but the mouth? If we
Yeah.
were to translate the dental model to medicine, you had degenerative joint disease in your hip, we would give you a crutch, because that's what a flipper is.
Yes.
It's a crutch.
Yes.
We have so much data that ties in the benefit of improving our overall health in improving the oral health into the improvement of the overall health. We have so much data, but yet we refuse to look at that. Why is walking more or less important than chewing? The mouth is the door to the body. It's the door to, the nutrition we put in our mouth to allow us to have the best health. Okay. It's a litmus test for level of inflammation in the body. We have testing that can, that can describe problems that only we can test for, that make a difference. I've had so many patients in my career that we did scaling and root planing on, and we bring them back 6 weeks later to check on how they're doing, how they're responding to the treatments, and and they're still as inflamed as they were before we did the scaling and root planing. It wasn't a bacteria issue, it was a host issue. So we
Yes.
started asking questions about how's your physical health? When was the last time you saw your physician? What's your diet like? What's your stress level like? Are you getting enough sleep? Sending them to their physicians, they come back thanking us because they were undiagnosed diabetic or pre-diabetic, or coming back in 6 months or 4 months for their perio maintenance saying, a lot of the things we talked about, the stress level in my life was just out of control, and you made me see that. You helped me see that, and I sought help for it. And so back in COVID, we established ourselves as essential health. The government wanted to shut us down.
Right.
We were viewed as peripheral health. We said, no way. We are absolutely necessary. We have to see our patients. They can't go to the ER. If you remember back then, no one went to the ER for anything.
Mm-hmm.
If you thought you had COVID, they'd test you, but they'd come out. They say, come over to the hospital, but don't get out of your car. Open your window this much, and they stick this 3-foot Q-tip in your nose, and they're wearing spacesuits, and they put the into the reagent, and they tell you have COVID or you don't have COVID.
Yeah.
No one was going to the hospital, and not that the hospital could do anything for dentistry. We fought like crazy to stay open for the for the health of our patients, because dental emergencies were going to happen whether COVID was on or not. And so we advocated like crazy to be there, and we learned, we established our place in the healthcare chain, delivery chain, and we did it damn good.
Yes.
The level of transmission in the dental office was less than 3%.
Negligible.
And the level of transmission in the ER, if you were an ER worker, whatever you did, whether you're a physician, nurse, technician, janitor, administrative, 35% of you got COVID. We know how to manage, transmissibility of viruses. We learned in the AIDS time, we learned in the SARS time, and we did our part to lower the curve. Essential health is essential health. It's not convenient essential health. It's essential health by definition.
Yeah.
And we should be, and I'm planning on advocating for, we are just as important in overall health as getting that hip replacement, getting that knee replacement, getting those cardiac stents placed in around your blocked arteries.
Slow deterioration is slow deterioration, no matter what part of the body it's in. And we have the ability to prevent it.
And we must reconnect ourselves into the healthcare chain and establish ourselves as a private practice fee-for-service dentist. I had relationships with other concierge type physicians, and patients that were attracted to us were those that were invested in their best health and that were willing to pay for it. So we've got that high end level of patients who were seeking this, but then on the other end, in FQHCs, many of them had medicine and dentistry under the same roof. We have an FQHC up here in Colorado called La Clinica. Ann Wynn, who's the president of NOAA right now, and she, she showed me how when a patient, a Hispanic patient, most of their patients were Hispanic, a good portion of them were Hispanic. 2/3 of them at the age of 50 had diabetes. Part of their diabetic treatment is they have to go across the hall to the dentist and get their checkup, and they had to get whatever treatment necessary in order so they can control their blood sugars better by reducing the inflammation in the oral cavity. Okay, so on two ends we're doing it, the fee-for-service and the FQHC, and we're starting to come together. Dentistry has found a way to attach the medicine through airway issues.
Yes.
Okay.
Indeed.
Pete Dawson, in his infinite wisdom, said we must be physicians of the masticatory system. Okay. We can't just look at the teeth. We have to look at everything. And Pete was really, really firm about just equilibrate them and they will be better. But 25% didn't get better. So what did we do? We started looking deeper. Airway was a big part of this.
Hmm.
And so we started treating airway and it became an explosion in dentistry because we found a way to get paid for it.
Exactly. And the absurdity that you and I talked about before we hopped on here is, why can't we be compensated appropriately, not excessively, but appropriately, to help people stay out of trouble? In fact, this is going to be an issue for generations to come. That the amount of, you told me offline, the amount of reparative dentistry, restorative dentistry is not going to go away, but it's going to be less.
Right.
But we have to find a way to keep people healthy orally and otherwise, and we're in a super position to do that if we recognize it ourselves and demand that it be recognized.
Patients come to us for proactive health. They're
Hmm.
trained to do that. They come for cleanings and checkups. That's proactive health.
Yeah.
Patients go to their physicians for health problems. It's not healthcare, it's disease care.
Yes.
We're still in healthcare. And this was taken then from, Pete Dawson started, challenge us with that challenge to be physicians of masticatory system. Airway starts to happen. People like Barry Plansky, Lynn Carlisle, Whit Wilkerson start talking
Yes.
about, hey, holistic, not barks, berries, and sticks. Holistic, let's look at every aspect of the system that we're attached to, which is every aspect of our bodies, and start practicing that way. We
Yes.
need to reestablish our place in the healthcare improvement of the populations. And I see it as, I see a clear vision of this happening. And I'm really excited to be talking about this because, I did a general practice residency at Northwestern Memorial Hospital in Chicago, and I got to see the impact of oral health on systemic problems. And I got to see the impact of the oral cavity related to systemic problems.
Hmm.
It all came clear to me when I was treating a patient who had uh, um, um, valve disease. He had cardiomyopathies and endocarditis. I extracted an infected tooth, cultured the pus, and it was the exact bacteria that was in the vegetation around his heart.
Wow. Real
And this
genuine.
is not unique. This
Yeah.
is common. And we need to reestablish ourselves in the medical field that we're trained to do through our lens and our level of expertise.
I think
And
that's going
so,
to, go ahead. I'm sorry.
yeah, no. So we look at our current benefit model and, private practice benefits, $1,500 max. People complain, well, they haven't changed their maximum in 40 years. And,
Yeah.
it stinks. And bottom line is it worked for us for a long time. It really did, but it was an unregulated entity that really they position themselves as the helper of all patients, and basically we gave our control to them because we all accepted this plan. And the bottom line with the maximum, less than 6% of people who have dental benefits ever reach their maximum. So why would they ever raise their maximum? And this data comes from the National Association of Dental Plans. It doesn't come from the ADA. It comes from their own industry.
Hmm.
And it's not just one off, it's year after year after year.
Yeah.
Bottom line, though, the 100% for preventative, 80% for minor procedures, 50% for major procedures. When it gets to the 50% level, it doesn't work.
No, no.
Okay. Because
Dentistry
we're
is
not good
expensive.
enough. And we're not good enough to sell the patient the importance of that crown where they're willing to take out 50% or, several $100s out of their pocket and give it to us on a regular basis.
Yeah, I think there's going to be a need for vigilance on our part as individuals, and really keeping ourselves on the cutting edge of oral systemic and the real benefit, and behaving as healers, not just as mechanics. It's going to take a guy like you who's going to get us on track individually and collectively. No pressure, Brett. And it's going to take a level of communication with patients that we're going to have to help them realize, not from a commercialistic point of view, but from a quality and quantity of life point of view, that they demand that we be treated like the healers that we are.
And I see it in several Medicaid programs around the country. In Colorado, I just found out in Ohio. I got a great story about Ohio in a second, but we in Colorado removed the cap on the benefit plan for Medicaid patients. So it's truly an essential health benefit. You do what's necessary. You don't have to calendarize the treatment anymore.
Mm-hmm.
You do what's necessary. There's no cap. You can need 4 crowns, you get 4 crowns. I mean, it has to be going through the Medicaid system, which is very difficult to manage, I understand, and we're working on that too. Ohio, amazing. I was at the Ohio Dental Association leadership meeting this past weekend. They've advocated for almost a doubling of their rates in the Medicaid space. They went a 93 or 97% increase in their fees. And what some of them are doing, Hal Jeter in particular is their president-elect, he took the Medicaid fees and he did an analysis with his private insurance pay. Medicaid now is the best payer of benefits in the state of Ohio.
Wow.
So he took that to his benefit plans that he's participating in and said, hey, your fees aren't even at Medicaid levels. What the heck? And he negotiated ups raises in his fees in the private sector. The public,
This is
yeah,
just for his practice alone, or for the scope of all
in
of
his practice alone, because the dental benefits aren't going to do that across the nation, across the provider network. But he was able to do that. But I encourage everyone, look at that in Ohio, especially where it is more than what they're paying in the typical dental benefit plan. The public plans have a great opportunity. We've got a great opportunity to shape and grow those, and that will drive big improvements in the private plans too. And so
outstanding.
we're not saying we're not working on the private plans. We are working like crazy to enhance the benefit plans and make it easier to use and get better reimbursements, not only for ourselves, but in the best interest of our patients, serving our patients maximally. So,
And I think it stands to reason here. It's appropriate to say that the perfect solution doesn't exist. And we have to really exist in a world where we do good and do better and better. I don't know that the perfect solution is going to be right at our fingertips 6 weeks from now. I don't think that's going to happen.
yeah. And I'm in this position as president-elect for another 7 months and as president for the next year. I don't know if any of this will happen under my watch, but I'm going to do my best to drive some momentum and keep talking about these things and demanding that we as dentists take back our importance in the healthcare chain. And we
Yes.
need, and I have to send a plug in for membership, we need a unified voice, at least around this. Because if we don't, who's gonna run it? The biggest voice with the most dollars, that's the insurance industry.
Yes.
They are not providing treatment to patients. They are regulating what we can and cannot.
Yep.
And we have to take back our profession.
Yep. Yep.
Unified.
Yep. That's a phrase I've been screaming, and I'm trying not to offend anybody with it or be anything other than a voice of positivity and reason and going forward and making life good. But damn, we are provider is a dirty word in my world. We are practitioners, and industry makes me extremely uncomfortable. We are a profession, and yeah, this is business, Brett. But we've got to maintain that degree of professionalism, that degree of looking out for those we serve and for one another if we are going to take this profession back.
Yeah. And I feel that organized dentistry, specifically the American Dental Association, is the biggest lever in driving our profession forward. Every different professional organization has their own unique twist and why people join and stuff like that. But we're fractionating, and we need to come together unified with one voice, especially around this. We may not be perfect for everybody. Every member is not going to get everything they want. We have 160,000 members with a lot of opinions on way things should go. But we can all agree that the current benefit model doesn't work, And we can all agree that we've seen in our practices the improvement of our patients' health and wellness because of the work we do. And we need to drive a wedge through medicine and make this happen.
Yeah, and I'm reminded of the words of my mentor, the great Mark LeBlanc. Mark says, perfect is the enemy of done. And we have to recognize that. We have to we accept each other.
Yeah.
My wife, for some ridiculous reason, accepts me, and I am the farthest thing from perfect. And a good solution that's getting better and better is doable. A perfect solution tomorrow morning ain't going to happen.
Right.
It's going to take a lot of thinking and a lot of sleeves rolled up work. Let's do it.
And an openness to change, not just necessarily change, but evolution of our profession. It must
Evolution's the
evolve.
word.
Survival of the fittest. Those that are most able to adapt will thrive.
Yep. One final thing, Brett. The future of our profession in the coming decades, long after you and I have exceeded our academic shelf life, we talked about the generations younger than we are not requiring as much reparative, restorative, operative dentistry. So where do we go from here, Brett? Where do you see it going?
So just to lay out the landscape around this concept is my parents' generation, the baby boomer generation, grew up in the dental chair. Pretty much every single tooth in their mouth had fillings in them. And we've spent most of our careers, replacing, repairing, evolving the dentistry in that demographic's mouth. My generation, Gen X, doesn't have half the amount of dentistry that the baby boomers had. The generation below us has even less dentistry in their mouth. The current model of dentistry right now is we get paid when our drill is spinning.
Yes.
When we are cutting things, we get paid. We're not going to there will always be need for caries control, periodontal disease management, and things like that. But that's the bread and butter of our practices. 20 years from now, the baby boomers are going to be rolling off the patient list as well as the practitioner list. There's not going to be a lot of baby boomers practicing anymore. But so we must evolve the way that our business is done, and I feel the best way to do that is through a primary care model.
Mm-hmm.
And patients come to see us for proactive health. They come to see us for checkups and cleanings. That's proactive health.
Yeah.
Okay. They go to their physicians for disease care, for problems. It's not healthcare, it's disease care. They come to us for healthcare. And we have this opportunity to help in the primary care of our patients, not only with their oral health, but with overall health. We're doing A1C testing, we're doing genome testing, we're doing bacteria testing. We can see inflammatory markers in the mouth on a regular basis. And inflammation is the root of most of the chronic diseases we're experiencing in our lives.
Mm-hmm.
If we can be that practitioner that helps reduce the inflammation physically in the body from the work we do, and plant seeds that we need to reduce your inflammation through medical means, we can be that catalyst for the patients to live a much happier life.
Yeah. So the future of dentistry is bright. The future of dentistry as it was 10 years ago is bright, but not as bright as the people who are seeing the future for what it could be.
Yeah.
We really could be the source of primary care, like we've never been before, and like physicians may not be able to be.
Right.
That's exciting. That's adding quality of life. It's building relationships. It's building gratitude as a culture. My goodness, the possibilities are so powerful.
And we get to fully live in our purpose as healers.
Yep.
From a well-being standpoint, as a practitioner,
But,
I mean, what's more fulfilling than that?
So we start thinking differently about ourselves. We project that outward and demand that we be thought of as the trained, caring, healing professionals that we're supposed to be, that we entered this thing to be.
Right.
Yeah. Brett, I can't thank you enough for spending time with us here And just for you guys to know, Brett is going to be a carte blanche contributor to Better, Richer, Stronger. So anything that Brett would like to transmit to us, he's going to do. And thank you for being an open book, an open line for us. And I am just so excited to be a fan, a supporter. Whatever I can do for you, I'm doing, man. All you got to do is ask.
Thank you,
Thank you.
Alan.
Thank you
Mutual
for,
Admiration Society in
there
play
you
right
go.
here.
There you go. One drink in person at least. Well, no, I'm sorry. One
Coffee.
Perrier in person. One
That's
coffee,
right.
one
I
Perrier.
look forward
Yes,
to
indeed.
it.
Brett, thank you so much. Be in touch and please keep contributing here. Thank you for everything you do.
Right. Thank you. You too, Alan. Appreciate
All
you.
right. Thanks.